All right, I think it's time to go ahead and get started. Thank everybody for coming out. I want to introduce Dr. Amreen Kaur and Dr. David Friedberg for coming to speak about they kind of run the show at Final Frontier, and I think they can give us some pretty tangible, objective value so that we can get that passed in January or whenever you take it. So I think they're gonna tell us a little bit about how to do study prep, and they might even have some study codes if you ask nicely. So go ahead, David.
All right. Well, first off, thank you very much, the Texas Student Physical Therapy Association. We appreciate all of you. Thank you for inviting us here tonight. I know that it's a huge honor to be invited by all of you, especially because you're students. So that means that you are putting your trust within us. So me and Amreen, we are here and we are representing NPTE Final Frontier, which is an NPTE prep course. So today we're going to talk a little bit about NPTE 2024 changes and also strategies. So the reason we're talking about some changes is also because the 2024 version of the examination was updated. So that means that if you started in 2023, especially using practice exams, let's say, they may not have been updated to the 2024 standard. So we're going to cover what you have to know. So let the games begin. So as you know, the objectives, I just stated that, and we're going to talk about some study strategies as well. So big question here. Who is David? Well, that's me. So let me tell you. I am a licensed physical therapist in New York. I'm from Long Island, New York. I'm a doctor of physical therapy and I graduated from Russell Sage College in New York. I am the NPTE Final Frontier course coordinator. I am actually also a 2024 APTA Association Leadership Scholar, part of their program for this year. I am actually on the board of directors for the Foreign Academic Credentialing Tools and Services as well, which is an organization, a nonprofit that helps internationally educated PTs practice PT within the US. I'm also on the APTA. I'm an APTA member and a certified clinical instructor. I presented previously at the 2024 NABPT conference and also in 2023 at the World Physiotherapy Congress in Dubai, UAE. And I'm a proud alumnus of NPTE Final Frontier. Enough about me. Who is Amreen?
Thank you, David. I was telling you who's Amreen. Hi, everybody. And I am Amreen. I am a licensed PT, and I'm working in Houston, Texas. And I'm a board certified specialist in orthopedic physical therapy. I did my doctor of physical therapy from Loma Linda University, California. And currently, I am a lead instructor at OCS Final Frontier. Also, I'm a vice president of FACTS, which is, a foreign, it's an organization, nonprofit organization, where we help foreign trained PTs to kind of get in here and hear their struggles and get them through them. And then I'm also a fellow in training. So I'm doing my fellowship in orthopedics and sports manual therapy from IAR Houston. And I am an APTA member and a certified clinical instructor. I am also a wife and a mom of a 2-year-old daughter and a proud alumnus of Final Frontier. So here we are, both of us, kind of today with you guys to share our tips and strategies to tackle NPTE. But before we start and go ahead, I want to know from where you guys are. So we know we're talking about Texas here, but where in Texas you are? And which school are you from? Let us know in the chat.
Yeah, let's see where everybody's from in the schooling.
I'm from Houston, and my school is the University of North Texas Health Science Center in Fort Worth. And hopefully I'll be taking my board in July of next year. So
Great, that's great.
Awesome. Yeah, go ahead. Unmute
Marvel
yourselves.
Sports
Let's hear it.
for Dallas, Texas 7 University, TWU. Okay, Texas Tech, Lubbock. We get a lot of students in our outpatient setting from Texas Tech. University of St. Augustine, Austin. Good. Welcome everybody today here. Okay, so there's somebody who's going to University of Pittsburgh. Great. Okay, so David, the mic is all yours, and let's get it started.
University of Pittsburgh. That's great. That's where Vrunda, one of our instructors and OCS, she is over there. She did graduate from there too, so you're in great hands. Dr. Whitney too. Shout out to her.
Yeah.
All right. So this is your goal right over here. You got to earn it. So that screen right there. That screen right there is the screen that you are going to see when you open up your FSBPT homepage. So everything that you do in regards to the NPTE with registration, it's going to be through the FSBPT. So that's where you're going to register for the examination. Once you register for the examination, you get clearance to sit for the examination. They'll send you an ATT letter, and that's going to authorize you to sit for the examination. Once you get your ATT letter, don't be confused, it's not the phone company. It's not a bill. It's for scheduling. Then you go to the Prometric website and you input that number, and you'll be able to schedule your Prometric sitting time. So that page right here, this pass is going to be on your FSBPT website, that homepage. When you're viewing this screen, I think that it's very important to remember why you got started. Why are you here? Who are you here for? So you know what? If you want to engage in the chat, who are you doing this for? Why are you here? What got you started within physical therapy? Why physical therapy? I want to know the who, the whys, the hows, the whats. I want all of it. Because when you're typing that, and maybe you're just thinking about it, that's just going to help remind you when days get tough and hard, why you chose this field. Why are you making those sacrifices to study? Why are you saying no to going out with your family and friends? Why you cannot do something, you can't binge watch Netflix? Because this is going to be important for you. So never forget that. So let's talk a little bit about the changes that took place for 2024. Previously, in 2022 to 2023, they did have an update of their own. What they did was they added video questions. So these video questions, some of them may have involved something like gait. And yes, there was a lot of panic from students about video additions to the examination. I know we saw all of it because it's something different. It's something that you're not used to. But in reality, it's great. Because isn't this what you do in your clinic? Isn't this what you do every day? You watch, you view, you observe the gait patterns, the everything, the step length. You observe it. So video questions are very beneficial. So previously, the NPTE for the PTs. So we may have some PTs and PTAs here, and we always combine both of them. So for PTs, they used to have 250 question examinations. Now it's going to be 225 questions. So previously, it used to be 50 questions dropped. So it used to be scored out of a total of 200 questions. Now it's dropped 45 questions. So it's going to be scored out of 180. So I'm going to keep to this chart. So as I mentioned, 200 questions previously were 50 pre-tested. This way you get it out of 200. These questions involve text and graphics. Some of the items were video questions. For PTAs, it was 200 questions. 150 questions were scored, 50 pre-tested. The text and graphics, and then you had some video questions as well. So really, the only difference was the addition of the videos. But this year, was very new because they changed the format of the number of questions, and they also added case scenario based questions, which maybe your schools have already included that within your programs, the case scenario based questions. So in 2024, for PTs, now it's 225 questions. 180 questions are scored, 45 are pre-tested. Pre-tested just means that they drop them. You will not know which ones are pre-tested. The best mentality that you can have is that if you get stuck on a question, shake it off. Just like Taylor Swift, shake it off. Just shake it off. And just tell yourself that it's a pre-tested question. It's not going to count anyway, so move on. They're going to have up to 185 text, graphics, and video questions, and up to 40 scenario-based questions. Now, sometimes I know that that's going to be a big range, but that's going to give a lot of things that you have to work towards. So it could be up to 40 scenario-based questions. For the NPTE, for the PTAs, it's 180 questions, 140 are scored, 40 pre-tested, so 40 are dropped. Up to 145 questions are text, graphics, and videos, and then up to 35 questions are going to be case scenario-based questions. Before I switch it over to Amreen, so case scenario-based questions, if you're not used to that, what they are going to do is give you a, how many in the chat are used to a case scenario-based question already? Who here has already been seeing some case scenario-based questions or has been exposed to it? Anybody? There you go. All right. Awesome. So that's good that some of you are already being perfect. I love it. Some of you are already being exposed to those questions, and that's very, very important. So what they're going to do for those that may not be exposed to it, they're going to give you a blurb, pretty much as if you just got a documentation as to the patient. You got their file and you're reading their name, their date of birth, what they're coming in for, their diagnosis, what their range of motion is, what their manual muscle strengths are, what their deficits are, maybe even what their goals are. So in a blurb, you're going to have all of this information there. And then there's going to be 3 questions based on that case. All 3 of these questions are not, even though they're related to the case that you're going to see, they are not going to be related to each other. So if you get, let's say out of 3 questions, you get 1 wrong, it doesn't mean that you lose the entire case scenario-based questions. If you get 1 wrong out of the 3, that means that you still got 2 correct. It's not going to impact one another. So I think that's very important to know. That being said, I'm going to send it back over to Amreen to go a little bit further.
So when it comes to the content changes in 2024, let's discuss those now. So in the PT exam, there is an increase we are seeing in the percentage of neuro and cardio content, and there's a decrease in the percentage of modalities and endocrine and metabolic systems, and that reflects what we see outside, right? Like as an outpatient clinic, I have never used an ultrasound so far in my practice of like 7 years. And I think David is going to say the same thing. So that's now it's coming in the exam as well, that we are seeing decrease in the percentages of the things which we don't ideally see or don't do as much in the evidence-based practice world, right? So that's there, and there are some new additions like topics like gross motor development, telehealth, taping for edema. So those are some of the new topics, and some other ones are regenerative medicine and electrodiagnostics results. And some of the content areas have been removed from the NPTE exam. So phonophoresis, NDT, taping for lymphatic draining has been removed. So those were the changes for the PT exam. Now let's also talk about the PTA exam. So here for the PTA changes, there were a little bit more changes which we saw for 2024. So there's an increase in neurocardio safety equipment content areas, and there's decrease in modalities and integumentary systems for the PTA. And there are some new topics again, as it was seen in the PT changes, content changes we're seeing over here, like gross motor development. And then there were a lot of things which were removed from the PTA exams. So some of them, example, the phonophoresis, non-selective debridement, topic agent iontophoresis, all of those were kind of removed. And then also some of the things like taping for neuroed, pain, intermittent pneumatic compression, and positioning for the vestibular dysfunction, things like that were removed from the PTA exam, and that's a good thing, I would say, overall. So yeah, those were the content changes which were made for 2024. And back to David again.
All right. So let's take a little bit of a step-by-step approach as to what we want to do. So I'm going to start from the top left and work our way through. Active learning. Active learning is so valuable. Active learning is actually something that helped me personally with passing the board exam. I needed multiple attempts, and I needed to figure out why and what I could do different. I needed to find out what different ways to study were out there. Active learning was so beneficial because you can only read over and over and over and over again so many times. Active learning, an example of this would be creating a PowerPoint presentation. So something I did was I made a list, and you may see me on social media always mentioning this because it's what I did and it's really what I found was beneficial. I made a list of 5 to 10 weaknesses that I personally had. So one of them was, for example, postural drainage. And then what I did was I created a PowerPoint presentation on postural drainage. It could be 5 to 10 slides. It could be 35 to 50 slides. It didn't matter. It was mine. But I created it as if I was going to present it to somebody. And for active learning, this can be really beneficial because just like any of you presenting to your class over there, when you're putting together a presentation, let's say Hawkins-Kennedy, you're doing one on special tests, right? And you want to describe the Hawkins-Kennedy test. And you choose Hawkins-Kennedy, an image of it, and you put it right on your PowerPoint presentation. When you see that presentation, when you see that image of Hawkins-Kennedy being done, you are going to recognize it and know that that's Hawkins-Kennedy now. Because you actually went out, you found it, you created it, you remember what it looks like. So when you see it on the examination, it's going to retain a little bit better. So creating PowerPoint presentations in active learning was very helpful. Make yourself a routine. Having a routine is so important as well. Routine. What does that mean? That means waking up on time, waking up early. If your exam is at 8 a.m., you better be waking up at 7 a.m. or earlier to be ready to go at it at 8 a.m. Because you got to figure you got some travel time ahead of you. And I'm going to let you know right now that if you may have to travel to your testing site, depending on the scheduling and if they got booked, or maybe it got shut down, or they temporarily closed, or maybe they lost internet. It happens. So be ready. And be open to, if you have to travel, be open to getting a hotel or something close to your testing center. This way it takes the pressure off of you having to focus on driving for a prolonged period of time. So routine-wise, 8 a.m., you got to be ready to go at 8 a.m. All of your practice exams should be starting at 8 a.m. Structure yourself. Have your exercise in there and everything. I'll get to that though. Sleep. Make sure you're going to sleep on time. That's going to be part of your routine. Don't be studying at midnight, 12:30, 1:30, 2:30 a.m. Yeah, sometimes it's going to be really cool to tell off your friends, yeah, no, I was studying until 2 a.m. in the morning and I couldn't do this. It's not going to be beneficial to you. Realistically, I'm just being straightforward with you. You're just jumping hoops for the sake of saying that you jumped hoops. You're not going to gain anything from studying at 1 a.m. Have a cutoff time. You need your sleep. Sleep is important. I know so many of you out there right now. How many of you have probably studied until 4 a.m. or 3 a.m. and then you had an exam at 8 a.m. You felt sluggish, or you had something to do at 8 a.m. Maybe not just an examination. You're sluggish in the morning. So don't shoot yourself in the foot. Something else, make a timetable. Having a timetable, breaking down what you want to study, how you want to study it, when you want to study it is so helpful. For example, what I would do is every single day I would write down what topics I wanted to review, what I wanted to get done. And it wasn't 10 topics a day. I would only write down 3 topics. I could always add to my list. If I wrote down 5 to 10 topics, am I realistically going to get through 5 to 10 topics? Probably not. And I'm probably not going to retain 10 topics if I want to do that within a day. So I did like 3 topics. I could always add to my plate. So that's okay. Do that. What's really beneficial with Final Frontier, we'll show you a little bit later on, but we actually have a timetable built into our structured schedule. So with the timetable, it's going to say exactly what the day is and what you have to review. And all of the readings are going to be straight from the NPTE Final Frontier review book that's going to be out later on this year. So it's going to have select pages. No, I'm going to answer that question right now because I know it's going to get brought up. No, it is not for sale yet. It is not released yet. Later on this year, though. But having a timetable is very important. And you want to know when to take your practice exams. Might as well go to the next one. Might as well go to practice exams, right? Why not? Something very important. You want to, in my personal opinion, I suggest taking 5 to 6 practice exams full length. NPTE Final Frontier, we have 3 practice exams full length. And they are all 2024 standards. 3 for PT, 1 for PTA for now. So something that's going to be beneficial for you to rack up your practice exams, please look at the FSBPT, the PEAT. How many of you have to take your PEAT exam with your cohort, with your schooling? You can answer in the chat. Do all of you have to take the PEAT exam? I love it. And I know that it stinks because you're like, why are you making me take this examination right now? I'm still a student. I still have so much to do and everything. It is so important and valuable because that PEAT exam, the retired PEAT, is actually an older examination that was for licensure that people sat for and officially took. The practice were questions that are on the same page, same level that were submitted, just not utilized to the public. So you have the academic FSBPT PEATs, and then you also have the FSBPT PEATs that you could purchase on your own. So if your school doesn't purchase them, you have to, the academic has to be done through your school. Your school has to do that purchasing. You can't. So they actually have a total of, on your own, 4 different examinations. 2 versions. What that means is that one version, version number 1, we'll say, is 1 practice PEAT, and then another, and then 1 retired PEAT. After you complete with those, you can only take them 1 time, scrap. Then you can go through and you can, if you wanted to, you can always purchase another version, which is going to be their second version, which is going to give you another practice version and another retired version. You're going to have the rationales. So for all practice exams, make sure you review the rationales. Don't sit through all 5 sections at once. After section 2, you are going to have a scheduled break for PTs and PTAs. Take that scheduled break. Do not just plow right through it. Just like you watch basketball and everything, guess what? LeBron James still goes to the bench and sits down. He doesn't play every single period, every single minute. I know with the New York Knicks, Josh Hart came pretty close to playing it, but you still got to get to the bench. You got to sit on the bench. You got to take those rest breaks. You got to take the breather. So after section 2, please take those breaks. Don't just plow right through it. Also, they have a tutorial before your actual examination. So before all of your practice exams, take time to yourself. Sit in front of the computer. Set yourself up in a situation similar to your exam simulation. You want to simulate it. And take 10 minutes before and just breathe there. And just relax. Don't just sit there, start the exam, and go right into it. Give yourself time to get adjusted to it. The way that I always view approaching the examinations and questions is as if you are playing basketball and you're going up for a free throw. Or maybe you're approaching a golf ball and you're ready to hit it off the tee. You close your eyes, you may take a few breaths, deep breaths, You're going to visualize what you want to do. You're going to breathe a little bit, and then you're going to do what you want to do. So take that time. Being accountable is I'm going to keep on saying that everything is so important, because everything really is so important. That's why we're presenting it to you. Be accountable. I'm sorry, you're not in elementary school any longer. You got to hold yourself accountable. You got to hold yourself structure. So me and Amreen, we could tell you study every day, 4 to 6 hours, do the work, take the practice exams, enroll with the prep course. We can tell you to watch the lectures, do what you got to do, get your exercise in there. At the end of the day, you're going to do whatever you want. Be accountable, hold yourself accountable. You are adults and you can do this. I know that this is difficult, but you can do this and you're going to make it through it. Just believe in yourself and know that it's going to be worth it. Exercise. Exercise, meditate, self-care. I almost brought into it earlier. Exercise is so important because exercising is something that I neglected when I started preparing for my examination. And then I realized how important it was on a repeat attempt that I needed to exercise. I used to tell myself that if I have time to exercise and I choose to exercise instead of studying, then it's my own fault that if I do poorly on an examination, that I chose to exercise instead of taking an practice exam or studying. Don't have that mentality. So exercising, meditation, self-care, the way that I started to think about it was a part of my studying. It was a part of my routine because that gave me the energy to keep on going forward. It gave me more emphasis to just keep on pushing. It rejuvenated me. So exercise, meditate, self-care, and don't feel guilty about doing so. Don't feel bad about doing so. You already have enough pressure. Don't put more on yourself. Of course, if you're going to go out partying and having fun, going to a concert and stuff like that, great. But earn your breaks too. Earn that time with your family, your friends, your spouses, your children, whoever. Earn it. Repeat the process. Every day, do the same thing. Repeat. All right, maybe here and there you got to take a timeout. But repeat. You can do this. And then you're going to see that pass screen. So that being said, I'm going to send it back over to Amreen for some preparation tips and checklists.
Thank you, David. It was a lot in depth, which you have discussed with the students here. And I think the slide is similar to what he said, and I would briefly talk about them. Though, so balancing everything, balancing your family, your rotations, your study time, your friends, everybody, like you have to balance your life with all the things going on. So you have to gauge what is important at what point of time. When your studies are important, you have to give them time. When it's your family who needs you, they need to get time, right? So you don't want to burn out in any of them just focusing on one thing and not like, managing it all together. So that's very important. Location where you're, setting yourself, studying, where you're taking your exams. It has to be like created in a way that that it's going to help you to retain information and there are less distractions. That's what I would say in that way. Textbook there, if you go on Google and think like see the checklist for NPTE, studying for NPTE, you'll see there are a lot of textbooks which are being mentioned. The pro tip is not to read each and every page of a textbook because it's going to burn you out really pretty soon. So knowing your strengths and weaknesses would be the most important things. For me, if I talk about my NPTE journey back in the days when I took it in 2017, I knew that my cardiopulmonary was very strong. I really had a very strong background in that area, so I didn't have to even touch the books, versus I was like just able to take some practice questions and the exams, and yeah, that made my confidence even much more. Versus neuro was never was my cup of tea ever, not even now. So yes, I had to put in some extra effort and kind of textbooks, YouTube and Final Frontier. Like there was so many other things which I had to combine because I wanted to make that as my strength area. So I kept digging in. But yes, so the whole idea is know your strengths and weaknesses and then take them as a guide and not like the primary thing to kind of work on. Practice exam for NPTE, I would say take as many practice exams as you can take. But if you're enrolled in NPTE Final Frontier or you're thinking about it, we have a lot of exams for our students in which are like there to build your endurance, there to make sure that you know that which direction you are going in, what are your strengths, what are your weaknesses, and then guide you through the process to make those areas stronger, so that you can do good on your exam. So that's something which I definitely been emphasize, and David has been emphasizing a lot as well. And also one thing is taking the practice exams, but the other thing is reviewing your exams, whichever you have taken. Even if you got your questions right, wrong, you need to review them to know that you know the concept or it was just by fluke. So that's just going to make your reasoning much more updated, and you will feel much more confident about it. Now, everything, and David again has talked about the timetable. Yes, this is one thing I feel it will make your life so much organized for those 10, 12 weeks you're studying for this exam. So we got to make sure that you have something very systematically present for you, which is helping you to like sail the boat through the NPTE, and it's not as daunting as we think. So just following a timetable or making your own timetable would be the best thing you can do for yourself before starting anything and taking this exam. And self-care, definitely that's something which you have to take care, meditate, exercise, go for concerts, go for movies, but just make sure that you earn those breaks, as David explained it earlier. And not that should not be your priority, but it should be the part of your preparation for sure. Like you cannot, I would emphasize this more enough that you need to take care of yourself. You cannot burn yourself into the books or the preparation or the burden of like taking this NPTE and you have to pass because you have this job lined up. You need to take it calm. You are a DPT or about to be a DPT. So you know things. You have spent all these 3 years into mastering all the concepts and everything. So you know it. It's just now applying all of that in an exam. That's what it is. So take it easy and then kind of go from there. Okay. Yes, so we have been talking about the timetable because I feel this is the most important thing when you're organizing your studies. So yes, in Final Frontier, over the years, we have refined our timetables so much that it is, I feel like I could vouch for one thing, and this is it. Like the timetable is really a beneficial thing, which we have made from all the content in areas. And David was talking about the book, the review book, which we are coming up with, and we have included a lot of information from the book, which would be there in our timetable. And it is very organized in a way that you start from your basics and then you build up on your basics and bigger concepts. And then it will tell you when to take your exams, exactly how many exams you should be taking and how much break you should be having in between, just a rest day break, right? All of that is mentioned in our timetable. So it's a kind of a no-brainer, I would say, to get yourself into. And this program has proven for so many schools, so many students for years. You all know about Final Frontier. So we know we have the best program out there, and we can help you to achieve your goal to becoming licensed PT as soon as possible. So this is something which I would highly recommend to kind of look into and focus on. Now, when it comes to NPTE questions, the exam itself, there are different type of level of questions which you will see on the exam. So kind of coming first of all from like concept questions, like there's a concept behind that. Why would you not make a patient do open chain exercise who just got their ACL repair done recently. Why? What is the reason? What is the concept behind it, right? The moment arm and everything, and how eccentric loading or concentric loading too much can work negatively on the healing structure inside, right? So concepts question, like you know the concept, you're able to answer them. Then there will be questions like prevention and emphasis kind of questions. There's a lot of safety kind of questions, which will be how do you promote safety and post-op protocols, like you're not making them do certain kind of movements. Let's take an example on that, like a patient who just got their rotator cuff repair done. You're not making them to do elevations past 90 degrees. You're not making them do it actively in the first 4 to 6 weeks, depending on how massive was the repair, right? So knowing the safety precautions which you will be taking with these patients, and those kind of questions you will see in all the different categories like neuro and MSK and cardio. You'll see these kind of questions everywhere, scattered everywhere. Then exact opposite questions. They're kind of questions where you have two options in the question, where either the option says increase in the value of so and so and decrease in the value of so and so. So you know the answer is between it's between those two options. Yep. And then I would say the last one, or the most important one, would be your think gold questions. So those are the kind of questions where you know, like an MRI is a better diagnostic tool for lumbar herniations as compared to X-ray, right? So gold standard, you need to know your gold standard things, and then they will stay and stick with you. Okay. So I'm again handing it over to David for the next slides.
All right. That was incredible. And as you know, we've been talking about the practice exams a lot. So, that being said, obviously, it is very important to know. So, for the PTs, we already mentioned about for Final Frontier, we have 3 full-length 225 question examinations. We also have mini exams. So, 2 50 mini exams. That's going to be beneficial because you can always, sometimes there's going to be a practice exam, let's say, that may not have that last section in there. So that means that it's going to be good to take it at the end. We have 2 different structures. So one's a PT full live course and one's a PT study bundle. The study bundle is an independent study bundle, which is available to students who maybe you're feeling confident, maybe you have priorities such as a full-time job, and you're not able to attend the live classes. Maybe you don't need everything. All right, that's perfect. That's great. Most DPT students may not need that. So the PT independent study bundle would be a great option. For that, though, you're going to have 2 full-length practice exams with 1 50-question mini examination. So there's a slight differentiation between the PT full live course with the PT independent study bundle that you can see right over here. Study bundle, you're not going to get as many practice exams. In addition to that, there's many differences, but we could always dive into that later on. For PTAs, there's going to be 1 180 question examination and then a 50 question mini exam for PT independent study bundle and full life course. So let's break down a stem of a question. So what is going to happen is I'm going to read this question and I want all of you to answer me, okay? So what we're going to do is a patient presents to an outpatient clinic with right shoulder pain. They demonstrate limited active and passive motion of the shoulder joint. The patient reports increased pain with both motions. What is the best initial intervention for this patient? Now, yes, if you are wondering why that voice sounds so familiar to you when you're listening to a question, it is true. I am one of the hosts of the NPTE Final Frontier podcast. So yes. But if you notice in this question right now, I'm going to pull up the chat. And what I want you to do, what are some keywords that you notice? I know that we are going to be short on time. So really quickly, what is something that you notice in this question? Don't everybody answer once at one time. So I'm going to jump to it. So something that's going to be mentioned twice. There you go. Perfect. There you go. Get in there. Get active, everyone. Exactly. Both passive and active range of motion is mentioned. Also, the word pain. The word pain is mentioned 2 times. That right there is going to cue you that they want your intervention to be related to that pain. So when you answer this question, what is the best initial intervention? And yes, the best intervention is very important. Very important too is initial. It's going to be addressing that pain level. So that's something that's very important to know. And once again, check out that last sentence. What is the best initial intervention for this patient? That right there is asking you what they are looking for. All right, let's go to the next one. A patient presents to outpatient physical therapy with limited right shoulder active and passive range of motion that are pain-free. What is the best initial intervention for this patient? So really quickly, what are some things that you notice in here? What are some things that you notice in here for this question? There you go. Okay, pain-free. Perfect. What else can you notice? It's going to be very similar to the last question. Very similar. So right now we got initial, we got pain-free. Hit me with one more. One more thing that you notice in this question. There you go. Perfect. Yes, there you go. The range of motion. The range of motion is limited with passive and active. Perfect. So now you're going to recognize that this patient is pain-free. And they're limited in both active and passive range of motion. So that means that you're going to want to address the joint restriction that's taking place. So to address that, most likely the best intervention initially is going to be a grade 3 to 4 mobilization that you're going to be doing. Good job, everybody. Next up, I'm going to pass it back over to Amreen.
Hey, so back again to me. So in our course page, our courses have been divided into 3 phases. And the 3 phases are based on how to build your confidence to a level and building all your concepts in a way where you don't feel overwhelmed in the beginning, which you should not be, but you should be building on your basics and then kind of going into bigger concepts and final pushes for revision. So phase 1 for PT and PTA course, our focus had been to build the basics. Going into this exam, we sometimes forget that we need to know our basic things like muscle function, muscle, actions, and how that can relate to nerve damage and things like that. So knowing your basic would be the first thing you got to do when you start prepping for this exam, right? Your myotomes, your dermatomes, your cranial nerves, your lung volumes and capacities, knowing what is preload, what is afterload, all of those, the basic things on which all these bigger concepts are built up. So that's what is in the first phase. So we call that as an acute phase of NPTE, where you have to be cautious. You don't have to overwhelm yourself with too much of information. So we're going to keep it more like into basics in the first one for every category, every content area. And then when it comes to phase 2, which is more now coming into more concepts and, talking about more differential diagnoses and then kind of going into some intervention, more examination, more in-depth examination. So all of those concepts would be coming in here now in the phase 2. Phase 2, I feel, is the most crucial, where you're building your confidence, where you start taking your practice exams and start knowing your strengths and weaknesses and focus on them, because you still have time to enter into the phase 3 and kind of go from there for the final exam. So the phase 2 is the most important one after having your basics, it went through. So the third phase is more PT specific, because here, because how the PTA exam time is, like, it happens before the PT exam. So the more time is given for the PT exam over the year, I would say. So for the final push, the idea is that we need to review all our things which we did in phase 1 and phase 2. So knowing all your rehab protocols like cardiac rehab and your protocols and all the differential diagnosis, all examination, how it has to be kind of correlated to each other. And going over all those question types, which we discussed earlier, and kind of going from there. In the course itself, we have a lot of emphasis on the phase 3, where we host a whole mega review week for students taking NPTE, and our whole team comes together to help our students to get through those review classes and then kind of go from there. So that's what it is. So idea is to build your confidence. That's what we are trying to do here. Okay. If you feel like you don't have enough of it, we are here to kind of help you. And our team is really, really great and works hard to kind of get through with all our students on a ground level, and kind of talk through your weaknesses, your troubles, and everything, and get to a point where we can solve them and we can help you to kind of and guide you through the process of getting through the other side of the line, right? So that's where the course is, like the foundation is on these 3 phases. So let's go ahead. So yeah, so not just the, the course and everything, but we have a lot of free resources to follow, and we have a lot of things which we keep we keep it all active. So there's a lot of content which you will see on our Instagram page, and then we post daily questions on the Facebook group for NPTE Final Frontier. We also have an app, so where we always and every day we have daily questions in there as well, and that goes Android and Apple phones as well. So definitely something to kind of look into. We also have a YouTube channel if you are still interested in YouTube. I know the newer generation is going towards more like, different things, Reddit and TikTok and things like that. But we're still kind of on YouTube, millennials here as instructors in the team. NPTE Final Frontier podcast, and we have the host here with us. David is here, so he can kind of tell you more about it if he wants to. But it's a great podcast. So all of these are free resources. So something, if you want to get a hang of it, like how the daily questions are, what are like how exactly the questions are on the exam. So this would be the good platform to start off with and go through and know our team better. That's what I would also say. And again, mic to David.
All right, so after your NPTE, and I'm just going to say that we have become trendy. We are on TikTok. That's right, we're on TikTok too. So, but after you pass your examination, you are going to want to find a job. So we do have Career Final Frontier, which we thought was very important to mention during this presentation as well. So Career Final Frontier, what we do is help you with your jobs. We can help you find a job. All you have to do is email us your resume, and it's totally free of service for the job placement. And then in addition to that, what we do have CV writing, resume writing. We have salary negotiation, interview assistance. We also have mentorship. Let's say that you are new to a clinic, or maybe you just don't have the confidence to be in the clinic. We do offer mentorship as well. And in addition to that, we do have for Florida and California, jurisprudence examination prep. Not Texas, but Florida and California, we do have jurisprudence examination prep if you're looking to go over there. Currently, job openings are in Texas, Houston, and South Dallas, California, Maryland, New England, Michigan, New Jersey, New York. So feel free to reach out to us at any time once you get done with your examination. Staying connected. As we mentioned before, Amreen mentioned with the free services, stay connected. We have so many outlets that you can have free services such as daily practice exams. We are on Reddit. We have our Facebook group. Our Facebook group has over 32,000 people in our private group. We have over 1,000 people, 1.4 thousand of the PTA group. We are on Twitter. We are on Reddit. So make sure that you check us out. And you'll see in that corner over there, you'll see the 1,300 members. That's Telegram. That's a messenger app, very similar to WhatsApp, let's say. So when you enroll in the full live course for PT and for PTA, you will have access to a Telegram group. Now this is 24/7 support. So for PTs, you'll be in this group over here, the full live course Telegram, which has 1,360 members. In there, it could be 10 a.m., it could be 10 p.m. If you have a question or a doubt, or you just need motivation, you can just type it in there and someone is going to address you and help you right away as soon as possible. We have many members of the team in that Telegram group. So that's a big difference with the independent study bundle versus the full live course, because the independent study bundle does not have access to that 24/7 support as a full live course would. Moving on, life after the NPTE. Mentioned already the Career Final Frontier. We also have an alumni group. We have a scholarship, which we believe in that Dr. Singh has put forth. No student should be too poor to afford education. So we do have the NPTE Final Frontier Scholarship, which features the FSBPT registration fees and full life course fees. So it's two separate entities that you can apply for. So if you need help financially to pay for just sitting for the examination, you can use this. Or if you need help in paying for the prep, you can use this as well. We get a ton of applicants that send it in, and then we, based on what is submitted, we choose the recipients of that. Every cohort has 4 recipients. So that is something very important to know. And for any friends that you may know that may not be able to financially afford the registration fees or a prep course and can benefit from it, utilize the scholarship. Mention the alumni group, Career Final Frontier, content experts. Hey, maybe you want to join the Final Frontier team. It's possible. Reach out to us. It's an opportunity. Research opportunities, we have that as well. And as Amreen mentioned before, she is our lead instructor for OCS Final Frontier. So we have OCS Final Frontier and we have GCS Final Frontier. Yes, we will be expanding. And we have many networking events that take place at APTA CSM and around the US. We have in-person boot camps as well. Upcoming, we have in California, we have Stockton taking place. And then in Chicago, in December, we're going to have an in-person boot camp taking place in Chicago. These can be beneficial for you to travel to. We've had people travel to these in-person boot camps as well. What they are 2-day events. It's takes a weekend, so it's a Saturday and Sunday. It's over 5 hours on both days, and what it does is really gives you different content that you would get in the class. It's not going to be a repeat of what you get in the classes. It's going to be totally unique. It's going to be hands-on, in person, and very beneficial. If you have any questions about the in-person boot camps, feel free to reach out. And this is my favorite slide because this features all of us, and I am a big team player, as is Amreen. This is our team, alumni, friends, and family. You can see over here, this is featuring everybody, friends and family. This is actually from the recent APTA CSM that took place. So we look forward, and this is at Disney, which was incredible. But we all look forward to you and meeting you in the future. If you have any questions, feel free to send us an email at enrollment@nptefinalfrontier.com. There's Amreen's email, amreen.npteff@gmail.com, and davidf.npteff@gmail.com. You can visit npteff.com for more information. And this is a sneak preview of our textbook. And thank you. Thank you, Texas Student Physical Therapy Association. Thank you, thank you, thank you. And of course, thank you to NPTE Final Frontier for allowing us the opportunity to present to you all today. And I'm going to answer a question in here. Great question. Are there any upcoming boot camps for Texas? Not just yet, but let's keep in touch about that. Wink. All right. We'll definitely keep in touch about that. So if anybody has any questions, feel free to ask. If not, I'm going to send it back over to Carter. Thank you so much, everyone. Amreen, any last words?
All the very best with everything ahead of you, your rotations, your graduation, your NPTE, and we are there to support you whenever you need us, okay? And we'll see you soon at Houston CSM in 2025.
Yes, Terrell's in there. We've met and hung out with Terrell as well. So thank you, everybody. Feel free to reach out to us at any time. And of course, I'm going to end it with, if you haven't heard it yet from me saying it, get used to it. You are powerful. You are strong. You are a final frontier warrior. You will pass. Go after your dreams. Chase it down. Go get it. Thank you so much, everyone. Over to you, Carter.
Thank you, David. I just wanted to clarify. So you were talking about these codes floating around, right? So I know maybe some for the people in the meeting, if they have any discounts for students. I know we can also send this out to people who are not here. Maybe that's a separate code. Just up to the discretion of the NPTE Final Frontier crew over there. If you have,
Of course, we can definitely look into discounts for everybody that's in attendance and stuff, and within maybe anybody that's enrolled with membership of the Texas Student Physical Therapy Association. We can definitely look into what we can do. Outside of that, let's say that you have a class that is interested in it. We do have class discounts. So even if you have 3 members, so even just you and 2 other people that are interested to sign up for Final Frontier, there's already savings for you that you can get with that group enrollment. There you go. We have somebody in there that already has a group discount through their class. So that's the thing. Sometimes you may be thinking that you're going to sign up, but without communication to your fellow classmates, you don't know who else is going to sign up or who's interested. Have that communication, open dialogue, and you can actually find other people that are interested in saving with you as well. Something interesting as well is we do have a curriculum integration that's very incredible and has been praised. What the curriculum integration is where we actually partner up with your university, where maybe your university, maybe they'll either cover the cost, or they'll split the fees with you. And what that does is with the curriculum integration is that your professors will be able to actually track how you do on your practice exams. They'll be able to track how long that you are actually on that website. So let's say somebody in this class, I'm just saying a name at random. I'm going to say Amanda. I apologize if there's an Amanda in there. But all right, so Amanda, let's say that Amanda scores low on neuro. Your professor could see that low neuro score and they could say, hey, come into my office. Let's talk a little bit about this. I noticed that you're lower than maybe we want to be. And it can be really beneficial.
Let's not scare them.
I know, right?
Yeah,
But
but that's a good tool for your professors to kind of have a connection with you guys. That's what it
yes,
is. Don't get scared though.
yes, don't get scared,
Yeah.
but it's definitely very beneficial to check out that curriculum integration as well. But yeah, we could definitely talk about other different ways to save too.
all right. Thank you both so much for your time and the great information. Yeah, thanks again. Y'all have a great night. Thanks for coming out, everybody.
Thank you. Have a great night
Good
and a
night,
powerful tomorrow,
guys.
everyone.